wabarakatuh. Welcome everyone. Today we will be talking about a study published in 2026 in the Journal of Endodontics. This research was conducted by Zhou et al. Titled as Retrospective Analysis of Clinical Characteristics and Therapeutic Effect of Intentional Replantation. Intentional replantation is considered a last resort treatment in endodontics used when conventional root canal treatment, retreatment, or surgery is not feasible. Complex anatomy, persistent infection, and difficult surgical access are common challenges in these cases. So, the rationale behind this study is that most previous studies included small sample sizes and did not clearly evaluate the integration or prognostic factors. So, the aim study was to evaluate the clinical characteristics of intentional replantation cases and to identify the prognostic factors affecting treatment success. So, moving to the materials and methods. This study was a retrospective study conducted at Department of Endodontics at West China Hospital of Sichuan University between 2016 and 2023. A total of 445 patients who underwent intentional replantation were included. However, only 107 patients had a follow-up of at least 1 year. So these cases were used for the outcome analysis. Regarding the inclusion criteria, patients were required to have assigned informed consent, a phlebotomy and pre-epic radiographs, and complete clinical data. As for the exclusion criteria, cases with missing or incomplete data, lack of consent, or a follow-up of less than 1 year were excluded from the outcome analysis. So the procedure started with a traumatic extraction of the tooth to minimize damage to the surrounding tissues. During extraoral phase, the root surface was kept moist to preserve the prodental ligament cells, and the extraoral time was maintained at less than 15 minutes. Then a 3 mm apical resection was performed, followed by retrograde filling using MTA. Finally, the tooth was replanted into its socket and splinting was applied if needed. For the outcome assessment, the treatment outcome was evaluated after a minimum follow-up period of 1 year and was classified into success or failure based on both clinical and radiographic findings. Success was defined as the absence of symptoms such as pain, no tenderness on percussion or palpation, no sinus tract or swelling, and mobility less than grade 2. Radiographically, this included healing or reduction of the preapical lesion with stable or improved the surrounding bone. On the other hand, failure was defined as the presence of symptoms such as a pain, the presence of sinus tract or swelling, or increased mobility of grade 2 or higher. Radiographic findings included persistent or enlarged lesions, external root resorption or progressive bone destruction, and in some cases the need for extraction. Moving to the results. For the demographic characteristics, the study included a total of 445 patients with a female predominance of about 62%. Most of patients were between 21 and 50 years old, accounting for around 80%. In terms of tooth distribution, the most commonly treated teeth were mandibular second molars, followed by maxillary second molars, and then maxillary lateral incisors. Moving to the preoperative findings, most patients represented with percussion pain in about 78% of cases, prodental pockets in 50%, and sinus tracts in around 40%. Regarding mobility, most of the teeth had physiological mobility, followed by grade 1, and only a small percentage showed grade 2 mobility. Looking at the root canal treatment status, about 94% of the teeth had previous root canal treatment. Radiographically, CBCT findings showed that the most common bone defect was the tree-wall defect. In addition, about 62% of cases had no bone blade defect, while the rest show unilateral or bilateral defects. During surgery, several findings were observed. including root surface cracks in about 15% of cases, C-shaped canals in around 39% of molar, and external root resorption in about 9%. And about 14% of the teeth were not replanted, mainly due to the vertical root fracture, followed by a fracture during extraction or insufficient remaining tooth structure. For the outcome analysis based on 107 cases with adequate follow-up, the success rate was 78%, while about 21% were considered failures. Regarding prognostic factors, the study found that the absence of periodontal pockets and the absence of the bony blade defects were significantly associated with higher success rate. On the other hand, factors such as age, gender, tooth position, clinical symptoms, mobility, and even the quality or timing of root canal treatment did not significantly affect the outcome. Finally, intraoperative factors such as canal morphology, perforations, root resorption, and splinting also showed no significant effect on treatment success. This study has several limitations. First, it is a retrospective study which might introduce selection bias. Second, there is a reduction in the sample size from 445 to 107 cases for outcome analysis. Finally, the follow-up period was limited to 1 year, which might not reflect long-term outcomes such as late failure or root resorption. In conclusion, within the limitations of this study, intentional implantation is an effective option for managing complex endodontic cases with success rate around 78%. The most important factors influencing the success are periodontal condition and bone integrity, while most other factors have no significant effect. And thank you.